Hi, I'm Mary Moncton, and this is Module 5, the State of Texas IFSP and Transition to School Age. It is a portion of Part 1, Birth to 3, Assessments and Evaluations for Deaf and Hard of Hearing Children. This module is Module 5 out of 6. What you will walk away knowing today is what an IFSP looks like in Texas, who is involved in the evaluation process, common terminology and what it means, what tools are typically used and why they are used, and an overview of the transition from IFSP to an FIE. The IFSP process in Texas. The IFSP, as mentioned earlier, is an individualized family service plan. It is the actual written document, so the evaluation should actually happen before this written document is developed. The IFSP outlines the individual child and family service plan. There are 10 critical elements to your IFSP that I'd like to mention today. These are present levels of functioning, family information, expected outcomes that you, the family, would like to see, specific early intervention services and how they will be provided, where services will happen, and again, it's important to remember that these should happen in a natural environment for the child, when and where the services will happen, the frequency of the services, meaning how many sessions will happen across a specific amount of time, who will pay for the services, the name of your service coordinator, and the transition plan. I also wanted to mention DARS, the Department of Assistive and Rehabilitative Services, because this is where you can find a lot of support and resources for your family as you go through this process here in Texas. Who is involved? I like this quote from Partners Resource Network of Texas because you and the family, as the family, are crucial to this process. If there is a child who's diagnosed with a hearing loss, it is important to know that the early childhood interventionists and the local education agency are both involved in this process. There may also be an advocate or third party if the family requests it. Again, your service coordinator is an important part of this process. Specific evaluators such as a speech-language pathologist, occupational therapist, physical therapist, or a diagnostician of some sort may be involved in your child's IFSP. And again, specific service providers otherwise, such as an AI service provider, will be involved. Common terminology you may hear when going through the IFSP process is something called a referral. So you need a referral from your doctor in order to receive an evaluation, perhaps for speech and language or physical therapy, occupational therapy. Norm referenced, again, pairs with Cheryl's Module 2, where she talks about standardized assessment, terminology related to such, and where your child's skills may fall from norm reference tests or otherwise known as standardized tests. Age equivalency refers to how your child is functioning compared to children of the same age. Reliability and validity, again, supports what Cheryl talked about in Module 2 related to the reliability of a standardized assessment or formal assessment and the validity of this assessment. The reasons for that is that assessments for deaf and hard of hearing children should be scored carefully, and their reliability and validity relates to how the test was given and how it was administered. Developmental milestones is a term that you may hear also. This refers to significant milestones in a child's development or growth that we typically see with typically developing children. Such things are when a child starts walking, when they're able to feed themselves. They can fall under categories of communication, spoken language, walking, motor skills, things like that. And usually when you're going through the IFSP process or professionals are writing the IFSP with you, They will refer to developmental milestones and discuss whether your child has met them. A significant delay refers to a comparative term of how a child compares with children of their age. So a significant delay, again, refers to that bell curve, and if a child falls below what is expected or below average. Which assessment tools and why? Specifically to Texas, in 2011, DARS, which I referred to earlier as the Department of Assistive and Rehabilitative Services, here in Texas, their ECI program requires the use of the evaluation tool known as the Battelle Developmental Inventory, and this will determine eligibility for a child. And this is used to determine if this evaluation tool is used in order to determine eligibility. However, this is used if a child does not already have the diagnosis of a visual impairment or an auditory impairment. If the child already has a medical diagnosis of a visual impairment or an auditory impairment, other tools may be used as well to get a more comprehensive evaluation for that child with a hearing loss. There are other assessment tools that possibly may be used when evaluating your child at this age. There's a downloadable handout with some examples and resource links to such tools, such as checklists, developmental milestone charts, and things like that. Speech and language assessment tools, more specifically, are focused on in Module 4 of this Birth to 3 training video. The transition from an IFSP to an FIE is an important one, and it is really important to note that as soon as a child turns 3, it doesn't matter if it happens on a Sunday or a Tuesday or a Friday, as soon as that child turns 3, early intervention is no longer involved, and it is up to the local education agency to be supporting this child. For beginning at 27 months, it should be important to know that at the IFSP, it should focus on steps and services for transition to educational programs and/or community programs and services that might be available to you as a family. So again, beginning at 27 months of age, you and your team should be starting to discuss the possible programs that your child will be able to access once they turn 3. Again, beginning between 27 months through 35 months of age, you and your team should be scheduling, with your approval as the family, the transition conference between the family ECI program and the school district. So you should be scheduling that transitional meeting so that you would be able to meet with your local education agency and your ECI program in order to begin to develop the best plan for your child's transition into school. Also at this time, it would be pertinent for you as the family to go visit school district programs or any local programs or possibilities of placement that are of interest to you for a child who becomes 3 with a disability, and then to be able to identify any services that you might need at that time. Again, for a child between the ages of 27 and 35 months, it is important to complete notification to the local school if the child is possibly eligible to attend that school. Similarly, we should be beginning transition steps for enrollment if a child is going into some type of different community program. For children between 30 and 35 months of age, school districts with parental consent should begin to conduct evaluations to establish eligibility for special education services. So again, this is where it transitions from an IFSP, which is the Individual Family Service Plan, to an FIE, which is the full and individual evaluation as part of special education in the public school realm. And IEPs, which is an individual education plan for that child, can be developed and implemented by the child's 3rd birthday. So this all should be starting to get into process with the local school district in order to have the evaluations completed, recommendations made, and the IEP document prepared for when the child turns 3. When this happens, an ARD meeting is held. An ARD here in Texas is referred to an annual review or dismissal of services. So this would be an admission of services, admission into special ed services. And this ARD meeting is held to determine eligibility for this child in special education. If the child is eligible and the parent wants school services, IEP goals are developed, and they would schedule another meeting to plan for transition as needed. And then as soon as a child turns 36 months of age or 3 years old, the implementation plan for the school district, which I just referred to as the ARD meeting and the IEP plan, is begun. And this is because as soon as a child turns 3, ECI services end. So it's pertinent to be prepared and go through these steps as you transition from the IFSP to your child's full and individual evaluation that occurs through the school district for eligibility in special education services.